Hello everyone, good morning. Hope you're all doing well. Hope you had a good night's sleep. You've taken your babies to school, you're getting ready to go to work and also to your business point. Okay, so hope you guys are all doing well. All right, my name is Sophia, and today we'll be talking about pregnancy-induced hypertension, which we all know as gestational hypertension. And also along the line, we're going to still talk about preeclampsia. Yes, maybe when next I come your way, we're going to talk more about eclampsia and also every other thing that goes along with it. All right, so now I was listening to a podcast this morning, and in that podcast they were talking about dealing with postpartum depression. But I know from the beginning of the podcast, they started with the guest said she had to describe her journey of how she was pregnant without her knowing. Initially started with headaches, she started having swollen feet and all that, and through the process, because of stress, she had to put to bed her baby before the due date. Okay, and if we go through what she has said, it's pointing towards pregnancy-induced hypertension and preeclampsia. Now, we're going to talk about pregnancy-induced hypertension. Pregnancy-induced hypertension is known as gestational hypertension that happens during 20 weeks of pregnancy. All right, and this is when if your blood pressure goes higher than 140/90 in someone that is not hypertensive. Someone that is not hypertensive, your blood pressure goes more than 140/90, you are termed a pregnancy-induced hypertensive patient. And during this process, you will not have anything like proteinuria, like which we know as protein in your urine. No, there will not be anything like that. All right, there won't be issue of preeclampsia, or maybe you start having some visual changes and all that initially. So when you notice that you're already having this headache, because sometimes it comes with headache, when you start having this headache and it's really consistent, most times if you take paracetamol for some headache, it will go, right? But when you start having headache that is continuous, as in it's becoming consistent, please go and see your doctor. Okay, let's start from the point where she didn't know she was pregnant. She got to know she was pregnant, and when she went for the test, they told her she was 20 weeks gone. But before then, she was already having swelling of the feet. What are we saying? What are we driving towards? It's already driving towards what? Preeclampsia. Because most people, when this pregnancy-induced hypertension starts happening, the blood pressure is becoming more than 140/90. They are not monitoring this blood pressure. They don't put it under monitoring. Before you know, it will start graduating. It will graduate and it will get to the point whereby you start having visual changes. You start having this consistent headache that you keep having. You start having swollen feet. You start having swollen hand. You start adding weight unnecessarily. All right? Your face will become puffy. All these are things that you will use to characterize a preeclamptic patient. Okay? So, and in order for, by the time the person goes for the test, because when you get to the hospital, you meet your doctor will tell you, okay, let's do a urine test. These are signs of, from pregnancy-induced hypertension, he's getting to preeclampsia. Let's do some tests and see what is going on, isn't it? So you go and do some urine test. In that urine test, they'll check your protein level, they'll check your glucose level, they'll check your neutrophil level, they'll check your leukocytes level. Everything is inside that test they're going to do for you. It's known as urinalysis. So once you do that test and they find out that there is one protein in your urine, immediately they will pick it up, because by the time you know it, it will graduate from that state it is to preeclampsia. And if it's not well managed during preeclamptic period, before you know, it will be an eclamptic period, and the woman will start having seizure. I don't want us to go into eclampsia at the moment. Okay, now, how do people get to know, or how do women which particular kind of women are prone to this kind of gestational hypertension. One, if you were a first-time mom, we call it the primary gravida. If you're a primary, you have never had an experience of pregnancy before, you don't know how it is. It starts like that. You don't even know what to do at that point in time. You think it's just normal headache. Before you know, it will start coming up. Before you know, it will result to, preeclampsia. And number two, if you're a mother that is carrying more than one fetus, they call them multi-para women. When you have more than one fetus in your utero, you're carrying one, you're carrying two, you're carrying three, you're prone to these headaches. And during that period, what they do is they'll tend to put you on aspirin. They put you on aspirin in order to help to prevent deep vein thrombosis. I don't want us to go deep into this one. We're going to talk about that, all right? And it will also help you to prevent you from going into, what would I call it? Maybe going into this preeclampsia, because you're having multiple babies in your womb, okay? So, and another thing that would make a woman, you see a woman that has it, some of them is that maybe their family history. Maybe during their when the mom was pregnant or whoever, they had this pregnancy-induced hypertension during pregnancy. And the most important thing that can really cause a woman or prone a woman to this is called stress. When you are really, really stressed, you don't allow your body to rest. You're stressed emotionally, physically, mentally. It's not good. It's another thing that exposes a woman to be hypertensive during pregnancy. And if you are a mother that is diabetic, if you're diabetic before you became pregnant, or if you're diabetic before you became pregnant, you're prone to this also, because some people who are obese are prone to this pregnancy-induced hypertension. So in order for us to be able to monitor this, please, once it's 16 weeks, some places they will tell you once it's 20 weeks, you can start. Some hospitals will tell you as soon as you know that you are conceived already, you are pregnant, please start your antenatal. All right? I always speak to moms who are multi-para, who are already, they're giving birth to children. Maybe they've been pregnant for 4 or 5 times. They've had kids. And those that are already on high risk of pregnancy, once you're above 35, you're already high risk. So you make sure that you try and monitor your pregnancy during that period. So during that period, what they will do, they will have to give you hypertensive medications in order to reduce the blood pressure, in order to put it on monitor, tell you to have bed rest. Always try and have bed rest. And I always advise, please, fathers, in as much as you're busy, in as much as you're doing a lot of things, try as much as possible to be with the women. Try as much as possible to help them. If you cannot help them, get people that will give them helping hand, because it is not easy. You think that these women they're just on their own. They don't really know. They function the way you're functioning. No, hormones are working in them. Progesterone is working, estrogen is working. So many hormones are working in their system. And at that period, a lot of things are happening to them. You see them having mood swing, you see them having cramps, you see them having leg pains, you see them having a lot of things. Little things can trigger a pregnant woman to become hypertensive. Little stress can trigger them. I know, yes, we are strong as women. We always want to, carry the shoulder, carry the pain and all that, bear everything, but it is not easy. I must tell you, it's a difficult one. It takes a strong woman to stand firm when she's pregnant. So please try as much as possible. Dads, beautiful dads, wonderful dads, beautiful fathers, try as much as possible to help your wives. If you can, be with them, be at their side. Because this period is a journey of 9 months. 9 months is like 39 weeks. Sometimes 40 weeks. Sometimes 41. Please and please. Okay? Try as much as possible to help them at this point. So that they don't end up, going into the theater before time. Because if this preeclampsia is not being monitored, I know, yes, some women are really stubborn. I'm so sorry to say, but some women are really, really strong-headed. They don't want to take medications. They don't want to do this. They don't want to do that. But please, let's try and be guided. Monitor your body. Don't force it. You cannot, when you're pregnant, there are some certain things you can't do for yourself. You don't have to force it. You don't have to put pressure on yourself. Do the little you can do and rest for your mental health and for yourself and for that of the baby. Okay? Then when next I come your way, we're going to talk more. We're going to elaborate more on preeclampsia management and also the eclamptic management as well. So we can know and be ready for anything. Until I come your way next time, my name still remains Sophia, your midwife. I'm always here for you. Have a wonderful day.